Topcon's Maestro2 with Harmony Clinical Data Management is a one-touch, one-screen diagnostic solution that gives you a complete picture of each patient's eye health, simply and easily. Maestro2 is an automated OCT plus fundus camera that empowers operators to capture images of the macula and disc with a single click and in a single scan. Harmony is a device-agnostic, cloud-based data management solution that offers single-screen display of your diagnostic data. Let's take a look at how these technologies work together to streamline your practice workflow. Topcon's Harmony Data Management System integrates with your existing EMR software to streamline your workflow from the moment the patient enters the practice. When your patient arrives, retrieve her records from your EMR and order the necessary tests. Harmony pulls the information from your EMR and sends it to each connected instrument via the instrument modality work list. When it's time to capture data, your technician simply pulls up the patient record at each instrument, making the pre-test process quick and efficient. With Topcon's Maestro2 OCT, one click is all that is needed to acquire a wide-field scan showing the macula and optic disc, plus a true-color fundus photo. Harmony is a truly vendor-neutral data management solution, so you can interact with your data and images, whether they were captured on a Topcon device or an instrument from another manufacturer. When all of the tests are complete, the results are transmitted back to Harmony. Harmony syncs the results with your EMR software, ensuring ultimate connectivity with no manual data entry. From the patient's chart in your EMR, Harmony can be launched with one click. Login is done automatically to expedite access. Harmony provides a complete picture of the patient's eye health on a single screen. The clinical views can be easily customized by disease entity, so you can see only the information needed to make a diagnosis or treatment decision. The default glaucoma clinical view provides the structural and functional information needed to quickly detect glaucoma or eyes suspect of having glaucoma. The timeline view gives a holistic view of the patient's journey by presenting all available images by date. The glaucoma OCT and fundus reports are shown alongside the corresponding visual field reports. These data provide quick and comprehensive clinical decision support for glaucoma detection. In instances where the structural and functional data provided in the default glaucoma clinical view are not sufficient, the extended glaucoma clinical view can be used. This clinical view adds wide-field fundus photos to facilitate identification of comorbidities that may confound the diagnosis. The glaucoma progression view allows quick assessment of changes over time. The OU Glaucoma OCT and Fundus Progression Report and the Visual Field Progression Reports are displayed to provide quick and comprehensive support for measuring glaucoma progression. Single-visit OCT reports are also provided for each eye individually, and an OU report enables symmetry analysis. A dynamic fly-through option allows visual inspection of the patterns of change associated with the changes seen in the glaucoma progression clinical view. All of the glaucoma views may be customized to streamline your decision-making. The standard clinical view for age-related maculopathy is optimized to identify risk factors, monitor progression or conversion to geographic atrophy or wet AMD. An OCT B-scan and fundus photo for the right and left eyes is presented at the top of the screen. The slider enables scrolling through all available B-scans from a single visit to best visualize and classify drusen, hyperreflective foci, drusenoid PEDs, and other irregularities. OCT thickness maps for both eyes allow quantitative assessment of the retinal thickness and volume. Wide-field photos are also displayed with a slider to permit toggling between the color fundus image and fundus autofluorescence. The default clinical view for Neovascular AMD shows a larger OCT-B scan with a slider for scrolling through all available scans and a color fundus photo. Below the wide-field color fundus image, fundus autofluorescence and fluorescein angiography images are stacked with a slider control, so you can gradually move through all available imaging modalities. A thickness map report at the bottom of the screen reveals areas of thickening that may correspond to neovascularization seen on FA. All of the retina views may be customized to optimize your preferred workflow. We believe that your diagnostic solutions shouldn't leave you with questions. At Topcon Healthcare, we are in the business of answers.